Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning.
Good morning, and everything's so misty out there I can't even see the sun. It's okay.
There's some fire and stuff like that.
So you're on your way to New York.
I'm on my way to New York. You see, I have all my decorations and stuff for Taekwondo.
Why don't you take a minute and tell people about that? We haven't talked about that for a long time.
Yes, martial arts in general. It's so commercialized now, I'm one of the old-timer in martial art. So it's a way of life, and it teaches the recipient, teaches discipline. So when you practice martial art, you get to be very humble, very disciplined. You learn that just with the tip of one finger, you can bring somebody down to the ground. You can even kill a person. So how vulnerable our body is when you go for vital points in the body. At the same time, those same vital points can be used in acupressure for healing. So, the martial art go thousands of years, and it goes beyond the knowledge of medicine and science and all of that. And it teaches about mind over matter. So even me being a physician, when I walk over broken glass or when I break the neck of a bottle with my bare hands or break a few bricks with my knuckle, you don't have to overdevelop your body to do those things. It's called mind over matter. It's focusing all your energy in one point of your body. In that case, it could be the knuckle or the knife hand on your palm or the knife on your feet. And when you strike your object, you strike with so much force that the objective is for that object not to come and bother you again.
You don't know this, but I was introduced to this about 15 years ago, and the person was in Fort Lauderdale, and they had a big studio, and I don't know if it was Tai Chi or Taekwondo or what it was, but I actually had a picture on the cover of Boomer Times, I'm going to try to find it, where there were probably 10 men on each side of this man, big, heavy guys, and they couldn't touch him, they couldn't push him down, because he went into the zone.
Right.
And he started having me come to his home with another person, and he started to teach me how to go into this state.
Exactly.
So I understand what you're saying. I understand what you're saying. It must take a lot of training.
It's a lot of
do
training.
That.
It's like even meditation, something as simple as meditation. Some people say, I tried meditation and I don't know, I don't get it. I say, meditation is, you have to practice. Practice will make it perfect. So, I tell them sometimes meditation is like sex. Practice, make perfect. You'll keep practicing.
Yeah, well, sometimes not practicing. Anyway, we ought to go through.
Let's not go there.
Through that.
Let's not go there.
No, so the point of this is that you have been you have worked on this a long time, so that you're like in the highest level.
I'm the highest level. I'm one of the few grandmasters in the world.
I met the grandmaster who I interviewed him on the radio.
I'm the only MD grandmaster in the world. The only medical doctor in the world.
Absolute. Oh, I love that.
Yeah.
The only.
Yeah.
You're my only anyway, but the only grandmaster medical doctor. Wonder why that's true, why other doctors haven't pursued this.
I used to teach in Mount Sinai in New York. I used to have students there, and they will get, some of them will get up to the black belt level, the first level of seniority or expertise, and then they will stop there. So a lot of people would think, okay, becoming a black belt, that's my objective, and then they go and stop practicing. But then the more you go beyond the first degree black belt to the second degree, third degree, and keep going, you fall in love with the way of the art, the way of life. And once you hit that route, the way of life, it's really very difficult for you not to train. It's a very difficult thing to stop because you need it. It's like air. Keep you healthy, keep you young.
So that's your secret.
That's one of my secrets, yeah.
Your secret.
I remain very, very active. And I love to be physical, do physical activity. We're doing some remodeling at the office, the dental
you're doing it
department.
Personally, right? With your
there was a little video that was put on Facebook of me personally knocking down the counter. So yes, I love that kind of stuff,
So yeah, and it's interesting when you say that you're not a very muscular-looking person. So
no,
you're
because
saying
yes, it doesn't.
You don't have to be.
It's
muscular.
all about learning how to use the energy. And there is a physical law called Newton says that force is equal mass multiplied by acceleration. But then mass times acceleration. But then acceleration can be substitute for velocity square. Right? So that means if mass is 1 and velocity is 1, then 1 times 1 times 1 is 1. But if mass is 5 and velocity is 1, then 5 times 1 times 1, because it's velocity squared, still 5. So the more mass you have, you are just what you are. Now you take velocity. If mass is 1, but velocity is 5, 5 squared is 25. So velocity is much more important in the production of force than mass. So you don't have to be a big muscular guy. You need to have a lot of velocity. And as a matter of fact, the people that develop a lot of muscle, it tend to slow you down when you move. A very muscular person cannot move as fast as a well-built, thin person.
That makes sense. So you're now going to show off. You're going
to show
up to
off
New York
and educate young kids.
So is that what? Tell me what's going to happen up in New York.
I've been having it's close to 40 years. I created this organization, and what I do, I take kids from the ghetto, from underserved area, and they come and they train. And if they get good grades in school, they continue to train. They don't drop out of school. They don't get into drug and alcohol and illegal behavior. They can continue to train for life. And over the past 40 years, our dropout rate is less than 3% of our students drop out of school. And more than 90% end up graduating with some sort of degree. So I have a lot of them that are engineers in different fields. A lot of them have become officers, doctors, nurses. So, all kind of profession we have built through this organization. And it's been probably close to 40 years since I opened this organization.
That exciting. You said something, and there are women?
There are men and women, absolutely. Yes.
I guess there are probably more women today than there were maybe 20 years ago.
A lot more women today. And we have some of the female instructors now teaching classes and being role model for, kids and involve, girls and boys.
You are an amazing person. I must say that. We know that you are very good as an MD, but you are really very caring.
Kids, kids is one of my passions. I always feel if we can do something for our upcoming generation, we can do something great for society, for the future of society. So I have always worked with kids, and I love it.
I know you do, and that's why you really are a Renaissance man. I don't say that casually.
Thank you.
Because you care about that older adult so much, and yet you care about the kids. I mean, your daughters are so wonderful. They're so adorable, and your pets.
Yes.
And all the things that you do.
And the horses.
Your horses.
Yeah.
You know, you do touch a lot of people. And I was talking with Maria Saldani, I told you that, a friend of ours who's been very involved in Broward County. And it is amazing how long that you have been around doing things, but you're very humble. And that's what's happened too, that when people know you, they know who you are, but you're not a braggart, and no, you're not, because that's not who you are. So it's really been nice having you as our friend here on the radio, and I know so many people have been helped by you. It's something when you're on the radio, you have a certain charisma that they feel. You don't have to be, very tough or strong, but you're you're calm. When I see you in your office, I mean, this is Celebrate Mencia Day. You can hear that. When I see you in your...
Memorial Day.
Yeah, right. Remember, Dr. Mencia? I see you in your office in the way that you handle your patients. And it's interesting. You have such a diverse group of patients. I mean, you see an elder lady. You see strange-looking man.
Yeah.
Some of them are very strange,
very
big,
strange.
tall.
Yeah.
And then some people are very, you're not sure if they're even all there.
Yes.
Right? I mean, they're a little bit, I don't say weird, but they're just off balance.
Yeah.
And you have the same fix on all of them.
Absolutely. Yeah.
And it's great to see you in your element.
Yeah. I mean, as I teach young doctors to become good physicians for the future, I tell them that we are not in this field to play God. We are not here to play God. We are not here to judge people. We are not here to determine who's going to do well and who's not, who you're going to spend your time with. As some people come with a stomach problem, some people come with a brain problem. And, sometimes you have to treat the psych, and sometimes we'll get back
and
to that.
And we'll get back.
Welcome back.
Welcome back. I am glad. And I'm glad you're going off to New York. And I know you were talking a little bit about
Taekwondo.
But
mind over matter.
Mind over matter. So even though you say mind over matter, there are some diseases or some things such as low blood pressure that you can't have mind over matter, can you? Or maybe you can.
Well, yes, you can. Yes, you can. Because when you are able to control your mind, if you, I have seen when I go to Nepal and India, go to South Asia, how the gurus are able to drop their heart rate, but they can also increase their heart rate. So whenever you increase your heart rate, you're going to increase your blood pressure. When you lower your heart rate, you're going to drop your blood pressure. That's why a lot of times when a person goes for a massage, after a massage, a person tends to have a lower blood pressure than prior to the massage. If you go into a good sauna and sit down and relax and listen to some soft music, that's going to lower your blood pressure. So lowering your blood pressure has been equated with something good. But what we want to talk about today is what we call orthostatic hypotension. When we stand up, so ortho means erect, standing. When we stand up, the blood pressure drops too much. And what is too much? Let's say a person go to a doctor and they normally will sit down, or at home if you check your blood pressure. There are many stubborn people out there that say, I don't want a nurse to come to my house. Okay. But when you check your blood pressure at home, usually you will check your blood pressure sitting, and even worse, lying down. Lying down is going to give you a blood pressure very different, and you can practice this at home. You lie down and check your blood pressure, and there is no way that sitting or standing is going to read the same thing. It's going to read differently. Okay? So, orthostatic, how we monitor orthostatic, the simplest way of doing it, if you sit down and you take your blood pressure cuff and put it about the same level as your heart, and you check your blood pressure. Then you stand up and wait about 5 minutes. And then you recheck your blood pressure without removing the cuff from where you put it initially. Again, put the cuff around the same level of your heart and recheck your blood pressure. What is a number that should concern you? If, let's say, when I'm sitting down, my blood pressure is 120/70, and I stand up and wait 5 minutes, and I recheck that blood pressure, and now it's 90/50, that is a significant drop, because it dropped more than 20 millimeters of mercury. So the number, this is pencil talk, remember. So the number you want to keep in mind is 20. When your blood pressure on top or the bottom number, the systolic or the diastolic, changes by more than 20 points, that means you should be concerned. And that is important because a lot of people get scared of stroke and heart attack with high blood pressure. But we should also be concerned if the blood pressure is too low. Why? Well, if we look at the heart as a pump, right? If that pump is not working right, it's not going to push blood at the right pressure to go and irrigate all the organs, especially the brain, the heart itself, the kidneys, the liver, etc., etc., etc. So if that pump, for whatever reason, because you're taking too much metoprolol or propanolol or one of those beta blockers that slow down your heart, or you're taking too much blood pressure medication that dilate the pipes, the arteries, dilate those arteries too much, and the pump is unable to function normally, so your blood pressure is going to drop too much. So a person, let's say that initial blood pressure, go to a doctor and say, I'm getting headache and my blood pressure is 150/98. And the doctor aggressively treat that blood pressure. And from 150/98, now I drop that blood pressure to, let's say, 80/60. That's a huge drop. Now, what will happen with that person is that person sitting down at the doctor's office is 150/98. Sitting down at home is now 80/60, which is still more or less within the range, but that's a big drop. Now that person stands up and 80 becomes 70/40. Those are the people that say, I always feel dizzy. I always feel like oozy, lightheaded. I don't know if I need a B12 shot or something. I just need something to give me energy. Of course you need something to give you energy because your muscle need oxygen. And if the pump is not allowed to deliver the oxygen, the nutrient that your body needs to function, you're going to be fatigued all the time. Your brain is going to be foggy day and night because you are not bringing blood in. And sometimes it can really become an emergency. And I'll tell you, if you're on vacation now with the holidays, Memorial Day weekend, people go out on vacation, go out in the wood. If you feel really lightheaded and dizzy, lay down on the floor, put your feet on top of a chair so that they are at an angle or at least 25 degrees. And what that's going to do is going to help your heart pump a little bit better. You're just helping that pump deliver oxygen to your entire body. And you lay down there for some 5 or 10 minutes and you will go back to normal. But you're basically gonna have to continue to do that until you see your doctor. Because very low blood pressure can be detrimental for your body. A lot of people would, let's say they are sitting down and they feel fine, no headaches, nothing. And they want to get up to get a cup of coffee. And the blood pressure dropped by, let's say, 40 millimeters of mercury when they get up to get a cup of coffee. Guess what can happen? You can black out, hit your head, develop a hematoma, and die. Or you can drop on the floor and break one of your bones in your back or your hip or your knee. So it can be very detrimental to have very low blood pressure. So people should monitor their blood pressure, sometimes sitting, the way we described initially, and then stand up, wait 5 minutes, and that's called a orthostatic blood pressure check. And a lot of times when I send nurses to come to the house, they do all of that for me. They monitor all of that because you can check your blood pressure erroneously. And sometimes I get the doctor that come to my office to learn from us. And I have them check the blood pressure and I watch them. And if the cuff and the stethoscope is too low below the heart, it's going to give you a false reading. It's going to give you a reading higher than what it actually is. Or if you take that cuff and put it above the head of the patient and the stethoscope, above the head, then it's going to give you a low reading that it doesn't really belong to the patient. So it should always be, that cuff should always be about heart level. And the stethoscope also, so that way you know that you are doing more. Sometimes we have those blood pressure cuffs that go around the wrist. So you want to take your elbow and your wrist and put it horizontally so that when you check the blood pressure, and you can support it with the other hand, but once you hit that button to check the blood pressure, just hold that machine about your heart level. And your heart level is right on your chest. Okay, so as long as it's by your breast, you are heart level. Okay, unless you have big breasts and they drop a lot, then your chest. Okay, but you have to, it's important because they are different people and we have to treat them all the same.
Okay.
So a person, arm up at chest level, chest level, not shoulder. It have to be below the shoulder. That is not chest anymore.
And you have to be careful because many times you go to a doctor and the nurse or whomever is taking your blood pressure isn't doing it correctly. So be careful.
Yes, exactly.
I think we have to talk a little bit about how people are going to get in touch with you. So there are now 2 offices. It is AGI Medical and Dental Centers, and that's the Adult Geriatric Institute. That's what AGI stands for. Very important that you realize there are very few geriatric medical centers in South Florida. But this is one, and it's really good. So the one that started was in Fort Lauderdale. Dr. Mencia built up this fantastic practice there. It's on East Commercial Boulevard near Holy Cross Hospital. And I will give you the phone number. It's 954-489-1345. 954-489-1345. Now, if you're up in the Palm Beach County area and you don't want to travel down there, they have a gorgeous new office on Hagen Ranch Road in Boynton Beach. The phone number there is 561-270-6494. That's 270-6494. And as Dr. Mencia said, this is Pencil Talk Radio. Make yourself a little pad that you can put these numbers, because when you're not feeling well, you will get confused. You need to have these numbers and just go right there. Oh, I better call Dr. Mencia's office. Home visits are available for the homebound patients, and that's something else that you should know about. Now, if you want to go on their website, it's agifl.com, agifl.com. Okay, so I guess I want to continue with talking about the low blood pressure. When you're lying down in bed, a lot of people, all of a sudden you get up and you start to feel shaky. Isn't that the same thing you're talking about?
Right. What we should do, exactly. What you should do is, because that's not good for your body. Every time you do that, it's not good for your body. So sometimes people, they try to be brave and they stay either sitting or standing, and they just hold themselves to the wall or to something until it passes. But that is not a good technique. The right technique is, you have just dropped your blood pressure more than 20 millimeters of mercury. Go back and lay down, put your leg up a little bit, just put a few pillows, and raise your leg a little bit, or put your feet toward the back wall of the bed, so you can bring them up for about 4 or 5 minutes, good 5 minutes, and then bring your feet back down to the horizontal position. Then dangle your feet, sit up and dangle your feet and stay there for a little bit. And then stand up. But don't take the first step when you stand up until you are certain that that symptom have not come back to you.
Now, that doesn't ever happen to me. I don't have that problem. Do you have that problem? When you
No, I don't
lie
have
down,
that
you
problem.
get up, and I don't
get
either.
Up, yeah.
So when that's happening, what is it saying?
That means that either something that you are taking if you take medication, or something in your diet if you are in a weight loss program or something in your intake or something from your medication, either dietary or prescription med or over-the-counter med, is affecting either your blood vessel, dilating them too much. Those are the pipes where the blood gets transferred through with all the nutrients, or the pump is not working right. That's your heart. So, when you go to the doctor, you want to get checked for orthostatic. And a lot of times is, in my experience as a geriatrician, it's so much better when I get all this thing done at home because you are in your own environment. When you come to a doctor, you get dressed. Sometimes you put on a belt. That's going to affect your blood pressure. Mm-hmm. If you put on clothes that are too tight, it's going to affect your blood pressure. Socks. If you put on heavy, high socks or all those support stocking, you know, all of that thing affect your blood pressure. When you're at home, it's like that's when you get weight at home versus when you get weight at the doctor, it's a different weight. It's more of you when you are at home. You don't have all this thing on to get weight. It's just you. So the blood pressure is the same thing. A lot of time when the person has orthostatic hypotension, we check if the person has a history of smoking. We do a screening for aneurysm of the main blood vessel that goes through the belly. It's called the aorta. So we do what is called an abdominal aortic aneurysm screening. Mm. And if that blood vessel is dilated, now that pipe is dilated at that region, not because of medication of nutrient, it just is malfunctioning. And that's when I get Linda Hughes or one of my invasive radiologists to do a procedure without opening the skin, without opening the patient. We can do that with minimally invasive procedure to correct those things nowadays, where before used to be major surgery to fix a aneurysm. So that can be corrected. Some people, what they have on their legs, they have venous insufficiency. So what that means is when the blood goes, the pump is working fine, the pipes that is bringing the nutrients, they are working fine, but then that blood, it's not like you creating blood every time your heart pumps. So that blood need to come back to the lung to pick up more nutrients to go back and redo their job. So sometimes the vein, when that blood went from my heart to my big toes, now that blood need to come back to the lung and pick up more oxygen. And if the veins are dilated, varicose veins, and they are unable to bring that blood back, that's why the support stacking will help the blood come back, and that will affect your blood pressure also. So a person that, like myself, I don't eat salt. So if I have very low blood pressure, then I would have to start eating a little bit more salty food than what I normally do to bring up my blood pressure. Some people think that if your blood pressure is low and you're feeling kind of oozy and lightheaded, that you have to eat sweet. Sweet doesn't do anything for blood pressure. So don't go that route. It's going to give you diabetes, and if you're already pre-diabetic, it's going to tilt you over to the other side. So sweet have nothing to do with a person feeling oozy and dizzy. It's usually a little bit of salt. Salt will help you build up that blood pressure and raising your leg also. That's the better, more homeopathic approach to correcting your low blood pressure.
Okay, but let's say that, are there foods? We talked about exercise, which is very important, of course. But what about foods? What kind of food should people be eating if they have low blood pressure?
Well, healthy food, of course. I don't want people to go and start eating canned food, because canned food increases your blood pressure.
Salt.
Because it's salt preservative. So because they put a lot of salt as preservative, that will increase your blood pressure, but it will also produce a lot of harm. So instead of that, you can eat healthy, and those are the few people that I will allow them to have a salt shaker and put it in their salad, put it in this, put it in that. Just add some salt to your diet. And usually that will help, but you have to monitor your blood pressure because salt now becomes a remedy for you. It's a natural remedy to increase your blood pressure. And if you overdo it, guess what? Now you can develop hypertension and get a stroke.
Now, I ask you questions. Sometimes it's very unfair because you never know what I'm going to ask, and you always seem to know.
That's why I love coming to you.
I know. What is it in salt that does that?
Well,
see, you know. I'm looking at his face. He was so excited because he was a little nervous there for a minute. What's she going to ask me?
Well, what the salt does is salt, the sodium in the salt, take the water and transport the water back into the blood vessel. So by transporting more water, now if the pipe are dilated or anything like that, now the blood pressure is nothing more than the contact of the liquid against the pipe. So if you increase more influx of water into the blood, then the blood vessel now is going to feel the pressure of the blood. Into the arteries is feeling that pressure from the blood. So that will be normal tension now, no hypotension anymore. So that's what the salt will do. That's why a person that tend to eat salt when they don't need it, they tend to get swollen ankles because that salt now goes into the intertissue and take the water from the blood vessel into the tissue and pull it in. And that's what ankle swelling, ankle edema is all about. And people sometimes when they eat salt, they say, oh, my ring doesn't fit my fingers, they feel sort of puffy. That's excess amount of salt intake in something that you are eating. And it doesn't have to be a salt shaker. You have to look at your diet. Maybe you eat a lot of canned food. If you live in a retirement community, maybe they are serving you something that is loaded with salt and you don't even know it. Yeah, so look at your diet and see what is it that you are eating.
People have no idea about all that, but I just love having these conversations with you because you do explain things that are very difficult so easily. But just listening to you, I was thinking about the machine that we live in.
Yes, an amazing machine.
You as a physician must have your mouth open all the time thinking, how is this all possible?
Well, we have to believe that there is a God and that this had been created by God. And we know very little of this machinery. Very, very little. So we have to be humble, no matter how high we go into the education of medicine, that there's still a lot to be learned. And there's a lot of trial and error in medicine. And that's why at least in my world, I embrace both the holistic and the traditional medicine because neither one of them have the answer by themselves. So I feel like, bringing them together, I can pick and choose to see what will be the best approach. And I use it all the time. All the time.
Well, we know that. You love prunes. I tell that story about prunes and that, for a physician not to say, oh, we're going to give you this medication, just have prunes and that's going to take care of your constipation.
Yeah, I had a patient yesterday and I told her, my initial approach, if you want to follow, if it's me, what I would do, I would take turmeric first and see how we do with that. And I can give you a prescription for Mobic or Celebrex or ibuprofen. But if it's me, because I know the side effect of those prescription drugs, I would try. And she fell in love. She said, I can't believe I'm coming to a medical doctor and you are telling me to take turmeric. My mother used to take turmeric and she loved turmeric. So I'm going to go ahead and give it a shot at turmeric. I say, that's it. And I'm here for you. If it doesn't work, then, that.
And I have a package of flax seeds that I eat all the time because you told me to do that. And I have my vitamin D. It's true. And the flax seeds are quite delicious.
Yeah.
I almost put too much in it, getting all in my teeth. But no, they're very good. But as just talking about this, I was driving and all the cars on I-95. I travel on I-95 so much. And I was thinking in every car, was this body functioning. I mean, we depend on that car's going to do the right thing, so
Absolutely.
we don't. But you think about it, all the human beings driving and doing this, and we're all responding somehow. Our brain, everything's working. It's a miracle.
But, it's interesting how, you mentioned automobiles. People, take their investment and they buy themselves a car, right? And then they dare to make sure that car oil gets changed, that they put gas on the car, that there's water on the car, that the air pressure is fine. But they don't want to check themselves. I mean, are you free?
Yeah.
Are you a freebie in this world? I mean,
it's
your
amazing,
car,
you
you take care of your car, you take care of your motorcycle, you take care of the house, take care of yourself too. Go and get checked and, checking your blood pressure, and being too high is no good. Being too low is no good either. So from time to time, look for an MD, look for a doctor to take a peek at you.
Maybe it's a sign of weakness, they think. Maybe that's why. I mean, a car, they can do whatever they want, but maybe going to a doctor to have these checked, or maybe they're afraid. I don't know.
Or fear that they might find something. And a lot of my patients, especially my geriatric patients, some of them come every 3 weeks, every 4 weeks.
I love that about you.
And they're there and they get a quick checkup and blood pressure is fine, everything is fine. We get to sit down and talk for a few minutes. But it's so reassurance to them. And sometimes I get patients that say, can I come in 3 months? I say, it's up to you. And in a week or two, they are back in the office. I don't think I want to wait 3 months.
No, but it's unusual because many older people, they go once a year it's ridiculous.
It's
now
ridiculous.
That I know what
yes.
you say. I mean, in that 1 year, anything could happen if you could just find it while it's just starting to percolate.
You can fix it. It's like a plane en route. If you let that plane en route divert and you don't take care of it, it's going to take so much energy to come back to your path so you can reach your destination. So if you fix things very early in life, you can fix a little constipation before it becomes diverticulitis. You can fix a little upper respiratory infection before it becomes pneumonia and kill you. And only pneumonia can kill you. You can go to the hospital with pneumonia and say, they gave me antibiotic and I'm fine now. Not true. Because the lungs and the heart, they are very connected to each other. So sometimes you get those people that say, they say I had a silent heart attack, but I've never had any feeling of any heart attack. Well, during that episode of pneumonia, you could have damaged your heart and you don't even know it. And even the hospital might not pick it up because they are not even looking at the heart anymore. Now they're just trying to cure the infection and send you home.
This is a very complicated, and I believe that what you're doing is bringing people in there, even if they feel fine. You see,
even if they feel fine. That's prevention.
Fine,
yes.
Yeah, people who feel fine. Why do I need to go to a doctor?
And that's why we open on Saturday, and people
right.
can come anytime.
Right.
And
Are you going
come
there
and get
now?
checked. I'm going. Oh yes, I'm going to see my patients.
Yeah, but then you're leaving for New York
and
after.
then from there, I already have my luggage in the car. So from there, I go straight to the airport, go to New York.
Safe trip. It's Memorial Day. You're going to have some fun. And hopefully no one gets sick. But if they do get sick while you're away, you do have people who
I have people. Dr. Pham
is
on call. Dr. Pham is also a geriatrician, so he's on call, and he will take your call, and he's very sweet.
You only have nice, sweet people. We want to say to everybody, on behalf of Dr. Mencia, of course, have a great Memorial Day. We are having
a safe one.
Yeah, we do have Invite Health coming on very shortly. I'm sorry, I should never do that. I'm not supposed to add. You can cancel that out. We're still with Dr. Mencia. I shouldn't do that because we have your YouTube on with just you. I don't want to do any of that. Oh, well, sometimes I make these mistakes. But Dr. Mencia, don't eat too much.
Part of learning.
I know, part of learning. I'm always learning.
I never eat too much.
No, I know. Even on
I go on a cruise, and I say, there is no way I'm going to get my money back through food. People go on a cruise, and I see they get like 12 pancakes, one on top of the other one. So, they want to get.
That's your discipline from your
martial arts.
Yeah, martial arts.
Yes.
You're so controlled. You're an amazing person. I'd like to just sit there and just shadow you and learn from you. But Dr. Mencia, it's always a great pleasure. Let me give a phone number again for Fort Lauderdale, 954-489-1345. You can see Dr. Mencia's, just go to YouTube, put in Dr. Mencia. You'll see so many of his shows and listen and learn. People just, you're so charismatic. People love it. I think you could say anything. You could talk about dog poop and they would probably love it.
I had a patient from the radio show. I had a patient from the radio show that came to see me. And I say, so I'm talking to her, getting her history. And I say, something, I don't know if I should say this. I say what? What I picture of you and what I see here is so different. I say, well, tell me, I love to hear what you picture of me. He say, well, I picture this bald-headed, fat, short, old man, and then I come to the office and I'm watching you.
Gorgeous Spanish. This man that it's hard to sit and watch. He's so cute. Okay, everybody, that's it. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.